This is a heart, and you are looking at a heart from a person who is facing you. So this is that person's right side, and this is the left side. A heart has 4 chambers. The top chambers are called atriums, and the lower chambers are called ventricles. So we have right atrium, left atrium, right ventricle, and left ventricle. Let's start the circulation from your left ventricle because it is where the heart pumps the blood out to your body. The blood inside the left ventricle is pumped out through this big vessel called aorta. The aorta is the king or queen of vessels because it's big and it is where the circulation starts. The blood circulates your body and then eventually go back to your heart through superior vena cava and inferior vena cava. The superior vena cava is where the blood from the upper body goes into your heart, and the inferior vena cava is where the blood from your lower body goes into your heart, and they both goes into your right atrium. From the right atrium, the blood is pumped into your right ventricle. And then from right ventricle, the blood is pumped out to your lung. In your lung, your blood get rid of CO2 and pick up oxygen. So now the blood goes back to your heart, to the left atrium. From left atrium, the blood is then pumped into left ventricle and then pumped out to the body and goes back to the right atrium and then to right ventricle and then pumped to the lung and then pumped back to left atrium and left ventricle and then to the body. So this is the circulation of your blood. This is the figure from our textbook, and this is how I simplify it. You should try to draw it on your own. So let's start from the heart. It has 4 chambers: right atrium, right ventricle, left atrium, and left ventricle. The blood circulation starts from left ventricle. It pumps out through aorta to the body, and then goes back to the heart, to the right atrium, right ventricle, to the lung, to the left atrium, left ventricle, body, back, right atrium, right ventricle, lung, and then left atrium, left ventricle. So the circulation is like this. Okay? Now I want you to pay attention to these 2 structures, SA node and AV node. SA node is on right atrium, and AV node is between atriums and ventricles. SA node is what makes your heart pump automatically because it can release the action potential, which is the electric signals, 100 times per minute. So this is actually our intrinsic heart rate. If I take your heart out of your body and keep the heart alive, it will automatically pump 100 times every minute. It's about 100 times. Some people may have like 99 times, some people may have like 102 times, but it's around 100. All right, so the action potential travels through the atriums, making the cardiac muscle contract. And then it is collected at the AV node. AV node delays and relays the action potential to the ventricles. Why does AV node has to delay the action potential? I want you to think about the direction of the blood traveling inside your heart. It goes from atriums to ventricles, right? So if you want to do this, you want atriums to contract first, to push the blood to the ventricles, and then ventricles contract later. So that's why your AV node will delay the signal. Then it is very important to make sure that the signals travel through the ventricles precisely and very strong, because the ventricles are where the blood is pumped out to your lung and to your body. So it has to be strong and it has to be precise. So we have these structures called bundle branches. So we have right and left bundle branches. Some people call it bundle of His. And the reason is because the person who found this bundle breaches, his last name is His. Okay, so I have heard people say, why not bundle of hers? Right? It is not about a gender issue. It is just simply because the person who found this structure, his last name is His. All right, and then at the end of bundle of His, we have Purkinje fibers. The Purkinje fibers are even smaller surrounding these ventricles to make sure the signals are distributed to every single part of the heart or the ventricles to make it contract strong.